University of Ibadan, Nnamdi Azikiwe University, University of Nigeria, and Bayero University, Kano. Professor Egwu has been editorial board member, reviewer and editorial consultant to several local and international peer-reviewed journals. He is a pioneer member of the Governing Council of Postgraduate Physiotherapy College of Nigeria, a fellow of National Postgraduate Physiotherapy College of Nigeria, fellow Institute of Management Consultants, and honorary consultant manipulative physiotherapist to OAU Teaching Hospital, and a consultant to Medical Rehabilitation Therapists Board of Nigeria in 2012. He is the current head, Department of Medical Rehabilitation, OAU, and the Chairman Management Committee, the Chief Executive Officer of Nwuga Physiotherapy Foundation. Professor Egwu, who was captain of the College of Health Sciences football team, that for the first time won the Vice Chancellor's Cup in 1999. He has presented scholarly papers in local and international conferences and is a member of the Nigerian Society of Physiotherapy, Neuroscience Society of Nigeria, Society for the Study of Pain Nigeria, also a member of Society of Neuroscientists of Africa. In addition to this, Professor Egwu is a member of International Society for Neurochemistry and International Brain Research Organization. Professor Egwu is married to Dr. Bridget Uchenna Egwu, and God has blessed the union with 4 children. So I present to you Professor Egwu for his inaugural lecture.
Thank you, sir. Mr. Vice Chancellor, sir, principal officers of the university, distinguished colleagues from within and outside this university, members of the press, distinguished ladies and gentlemen, I'm grateful to the Almighty God for the privilege of standing before this august gathering to deliver the 375th inaugural lecture of Obafemi Awolowo University here in this prestigious Oduduwa Hall. This is the 4th in the inaugural lecture series given by professors of physiotherapy in the Department of Medical Rehabilitation. It is coming after those of great scholars like the late Emeritus Professor Vincent Nwuga, Professor Matthew Olaogu, and Professor Rufus Adedoyin. This lecture, titled Back Pain and the Healing Hands of a Nwugarian Manipulative Physiotherapist, The Journey So Far, builds on the first inaugural lecture given by Professor Nwuga, titled Genesis, Treatment and Prevention of Back Pain. Mr. Vice Chancellor, sir, in this lecture, I shall be taking us through my academic journey as it concerns the art and science of Nwugarian techniques of manipulative therapy, from where I met it as a student, a young lecturer, and where it is as at today that I am delivering this inaugural lecture. This lecture also provides me the opportunity to highlight the humble contributions I have made in research, techniques, skills, diagnosis, training, and advocacy for the use of Nwugarian technique, which is proudly made in Great Ife, in the healing of back pain and associated ailments. Reminiscence. First, Great Ife and its special advantage for youth adventure and development. My growth in this university was a complete physical, mental, social, and emotional development. It was not just an academic adventure. This is because as far back as 1989, I was the Social Secretary of the National Association of Physiotherapy Students, NAPS. I was part of the delegates sent by NAPS to welcome the physiotherapy students from the University of Nigeria Enugu campus into the national body for the first time. Just about the same time, there was a triangular football competition called Oshi Cup competition among physiotherapy students from University of Lagos, University of Ibadan, and University of Ife. I was the captain of the Great Ife team that won that competition that year, and also the captain of the College of Health Sciences team that won the Vice Chancellor's Cup in 1999. I saw in figure 2. From these events, together with my experience during my mandatory service in the National Youth Service Corps, the team spirit and the spirit of struggle that was already sowed in my secondary school at the Government College Afikpo was fully developed. This prepared me for the hard struggle of being a lecturer in the 90s. And for those of us who were there, knows what being a lecturer in the 90s was like. 2, the Nwuga era and my path crossing with academic influencers. I joined the Department of Medical Rehabilitation in 1993 and started my academic career under the mentorship of the late Professor Nwuga, who was the head of the department and who supervised my undergraduate dissertation and directed study, respectively. My undergraduate directed study, titled Low Back Pain, a review of some management techniques, exposed me to the challenges posed by back pain and marked the beginning of my journey into becoming a manipulative physiotherapist. Incidentally, my mentor, Professor Nwuga, was one of the best in the world. So I started to learn the rudiments of his ground skills, known as the Nwugarian technique of manipulative therapy. At this point, the subject manipulative therapy was very confusing. During this period, I encountered great academics such as Professor Joseph Balogun, Victor Bagluwa, and Aberoje. Others included academic icons such as Professor Isaac Owueye and Professor Ariola Sonia, who were our external examiners from the University of Lagos and University of Ibadan, respectively. Their in-depth criticism of our research was very enriching. Introduction. First, pain and back pain. International Association for the Study of Pain defined pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or defined in terms of such damage. But for today's lecture, we are talking about back pain. Back pain is defined as physical discomfort occurring anywhere on the back, that is vertebral column, ranging from mild to severe, as shown in figure 3. It has been established over the years that about 10% of back pain have underlying diseases as their cause, while 90% of the pain have non-specific mechanical causes. The back pain we are talking about today are those without disease causation. However, in the Nwugarian technique, back pain includes pain that is of spinal and sacroiliac joints origin, areas covered by the tape rule in figure 4. It also includes pain in the pubic symphysis, figure 5, temporomandibular joints, and craniocervical articulations, as shown in figure 7 and 8, with or without symptom referral to other organs and systems such as head, upper limbs, chest, lower limb, and so on. This is so because symptoms from these areas intermixes with pain of spinal origin, and Nwugarian technique can be used to treat symptoms emanating from the mentioned areas. 2, manipulative therapy. Manipulative therapy connotes the application of accurately determined and specifically directed manual forces to the body. It is the aspect of physiotherapy that uses mobilization and manipulation techniques for pain relief and restoration of function. Mobilization is a passive movement of a joint within the physiologic range of motion, which is under the control of the patient. Mobilization technique is more frequently indicated. Manipulation comes in as a last resort intervention for physiotherapists when conventional treatments such as exercise, heat, cryotherapy, and mobilization techniques have failed to achieve the desired result during back pain management. The Nwugarian technique consists of both manipulation and mobilization techniques. 3, the Nwugarian techniques of manipulative therapy. From the second paragraph of page 15 of Professor Nwuga's inaugural lecture, I quote, the system of mobilization which I have evolved is currently being used all over the physiotherapy world. In the United States and Canada, my techniques are collectively described as the Nwugarian method, a distortion of my name which I do not object to. Therefore, the Nwugarian technique is named after its progenitor, Professor Nwuga. In a paper published in the American Journal of Physical Medicine in 1982, which examined the relative therapeutic efficacy of Nwugarian technique and conventional treatment in back pain management, it was clearly shown that the Nwugarian technique was superior to the conventional methods. This fact has been demonstrated clinically and in publication in Nigeria and Japan in 2005, 2007, and 2008. The Nwugarian technique is an art based on scientific principles with growing evidence and an intimate knowledge of human anatomy and neurophysiology. It entails not brute force, but a logical and persuasive skill. It emphasizes the need for using physical tests to reach a clear diagnosis of the mechanical origin of the dysfunction to be treated as a prerequisite for success when the right technique is used. Some of the tests include spinal mobility tests, as shown in figure 9, supine long sitting test or innominate test, as in figure 10 and 10A and B, posterior dimple compression test, as shown in figure 11, vertical compression test, and scene rolling test. During these tests and treatment, the treater must keep an eye on the patient's face to monitor the person's response to your treatment. Some people may have frank or severe pain, as shown in figure 12A, while some others person may just be having mild or no pain, as shown in figure 12B. With that, you are not easily misled to make wrong judgment. So far, Nwugarian technique has been used for over 40 years, and there is no doubt that it is a very effective form of treatment when used by the right person for the appropriate case at the right time. Some of the Nwugarian techniques include vertical oscillatory pressure, as shown in figure 13 and 14, cervical oscillatory rotation, figure 15, anterior posterior unilateral pressure, figure 16, posterior anterior unilateral pressure, figure 17, facet joint mobilization, figure 18A, transverse oscillatory pressure, figure 18B, and specific lumbar rotation, as shown in figure 19. Techniques of manipulation may be direct or indirect, specific or non-specific. These techniques are well documented in his book, including The Manipulation of the Spine, published in 1976 by Williams and Wilkins Company, and the second book titled Manual Treatment of Back Pain, published by Krieger Incorporation, both in the United States. The Nwugarian Institute for Back Pain Management was formed, and many physiotherapists were trained and certified, as shown in figure 20. From the training received in the Nwugarian Institute, for the first time, people suffering from back pain could be examined and treated by a physiotherapist without external help. Therefore, the Nwugarian technique has led to the evangelization of physiotherapy as a bona fide profession within the healthcare arena. Professor Nwuga retired in 1998. Then my quest for self-understanding, which has been building up, began to get attention. The healing hands. The function of a manipulative physiotherapist can only be accomplished by manually furnishing the affected part of the body, whether it is skin, fascia, muscle, bones, ligaments, and joints, with a sequence of accurately determined mobilization or manipulative instructions and an appropriate emotional appeal to be acceptably processed by the patient. This is the only condition under which the healing hand can guarantee the efficacy and high success rate of the technique. So the manipulative physiotherapist must be in sync with the ground skills of mechanical diagnosis, tissue sensitivity, highly perceptive sense of joint alignment and malalignment, with a strong base in surface anatomy, human anatomy, and neurophysiology, preparing the base for perfect healing hands. In order to be able to develop the healing hands and mind that we practice Nwugarian technique, The potential manipulative physiotherapist is needed to know about the causes, distribution in the population, how back pain is treated traditionally, and how it is perceived by society. This information can only be obtained by research, publication, and clinical practice, and so I went straight to work. In an article I published in British Journal of Sports Medicine in 1996, the pattern of musculoskeletal injuries experienced in the youth core orientation camp was examined. It was found that youth corps members were physically relatively unfit, and the camp fitness program produced some adverse effect on their physical health, leading to injuries and pain. This brought their problem to the focus and has resulted to increased recruitment of physiotherapists in the youth service orientation camp clinic and a downward review of camp fitness program. Some tables in this article have long appeared with permission in the official journal of American Chiropractic Association. This study exposed me to the prevalence and challenges of managing back pain among the youths, as the data was collected when I was a sole physiotherapist in NYSC orientation camp in Maiduguri. To understand the nature of back pain in this environment, I and my co-researchers conducted another study in 1997 titled A Cross-Sectional Survey of the Pattern of Back Pain, Incidence and Characteristics in Some Occupations. It was observed that low back pain predominated at 74%, involving slightly more males at 59% than females 41%. And the ratio of low back pain to neck pain was 8:1 among clerks, craftsmen 7:1, traders and farmers 3:1, administrators and students 2:1. Young adults 26 to 35 years old were the most affected at 32%. In order to be able to understand how back pain is managed traditionally in Nigeria, I carried out an ethnographic study of traditional bone setters. From this study, a paper titled Traditional Bone Setting in Nigeria, Cases and Pattern of Patronage was published in 1997. From this and a follow-up study titled Skills, Materials, Procedures, and Therapeutic Philosophy of Some Bone Setters in Nigeria, that was published in 1998, we found that back pain constituted 17% of cases seen by bone setters. Some bone setters believed that back pain was caused by excess sugar in the body, hemorrhoids, and they call that jedi, pneumonia, old age, and when it is vertebral dysfunction, they call it Ogbonnia in this environment, which they manage using herbs, manual traction, as shown in figure 22 and 23, massage, depending on the ethnic group. Our studies also established that back pain was predominant among health workers. Excerpt of this paper was published in the Guardian newspaper, volume 13 of March 2, 1997. We have clarified that grip strength and grip endurance are lower in patients with cervical spondylosis than in apparently healthy people, and explained the physiological basis for this finding. Also in 1998, Professor Nwuga and I did a retrospective study profiling the clinical characteristics of back pain in 802 patients. We found that the onset of back pain in most cases could be related to specific events such as lifting, and that the level of L4, L5, and S1 were the most frequently affected. A longer initial pain episode and sickness absenteeism was evident in those who did not like their work. Most of the diagnostic labels used by the referring doctors centered around the intervertebral disc. At this point, the causes, general treatment, rudiments of manipulative therapy, and Nwugarian technique were getting clearer to me. So, under the guidance of Professor Nwuga, we co-authored a book titled Back Pain, Causes, Treatment, and Prevention in 1999. Mr. Vice Chancellor, sir, at this point, the veil dropped, highlighting the value of mentorship. Other contributions to the knowledge of Nwugarian technique. During the World Congress of Physical Therapy in Singapore, 2015, An American physical therapist presented a study on manual therapy, which was based on the work of Egwu et al. 2003. In the management of patients with neck pain, he substantiated the fact that force applied during manipulation of the spine using vertical oscillatory pressure was quite unique compared to other known methods of manual therapy. He reiterated further that the force was not actually coming from the fingers, but more importantly from the shoulder through well-extended elbow joint, thus transmitting an effective manual therapy during spinal manipulation. He also confirmed that he has applied this technique in the management of several patients, which has yielded positive outcomes in neck pain. Nigerians who participated in that congress were proud to be associated with the Nwugarian technique of manipulative therapy. I have practically demonstrated the anterior posterior unilateral pressure technique for neck pain therapy, established its scientific base, and compared its relative therapeutic efficacy with 3 other Nwugarian techniques. This was published in Journal of Physical Therapy Science in Japan, and this article is displayed in Physiosport, Musculoskeletal Research in the Spotlight, and PhysioBrain since 2008. These are websites assisting health practitioners with evidence-based practice. And this technique is currently recognized worldwide as one of the effective manual therapy for lower cervical neck pain. I have described the posterior dimple compression test for identification of sacroiliac joint dysfunction and demonstrated that it is the simplest mechanical diagnostic tool for sacroiliac joint dysfunction with high sensitivity and specificity. We have also explained factors responsible for the efficacy of manipulative therapy. In addition, we established the reliability and concurrent validity of bathroom weighing scale and sphygmomanometer in quantifying digital pressure force magnitude, which is important in the determination of dosage and delivery of effective manipulative therapy. It is important to point out that there are some terminologies that would be Nwugarian manipulative physiotherapists need to know to be able to talk about dosage. And these include: 1, the therapist's body, while standing erect on a weighing scale, is called the initial body weight. And the weight during the application of sustained digital pressure is called digital pressure weight. The difference between the initial body weight and the digital pressure weight is called magnitude of weight change. Digital pressure force magnitude in Newton is equal to magnitude of weight change multiplied by 10. 2, the digital pressure force magnitude is the amount of force applied on the spinal process of the patient's backbone to be able to mobilize it therapeutically. This force keeps increasing as pain reduces or reduces as pain increases. This is how dosage is determined. We also highlighted the fact that it is intensity and not duration that is associated with level of depression and functional disability among patients with back pain. We later brought to the knowledge of physiotherapists that low socioeconomic status patients with low back pain had experienced a higher number of life-stressing events and were more likely to show emotional and psychological symptoms, which influences the history and characteristics of their back pain, low back pain. These factors have been adopted by Chartered Society of Physiotherapy of Great Britain. My contribution in the area of back pain management is not only in manipulative therapy. I and my colleagues have contributed to the resolution of the controversy that swing patterns frequency of interferential current is more effective than fixed frequency, because our study demonstrated that neither has superiority in low back pain modulation. The healing hands started to heal properly. In the Holy Bible, the most common practice in healing by Jesus Christ is touch, laying hands on the one to be healed. And he said, therefore, lift your drooping hands and straighten your weak knees and make straight path for your feet so that what is lame may not be put out of joint, but rather be healed. This is to tell you that manipulative therapy is the most appropriate and natural way of healing human ailments. This is exactly what the Nwugarian technique does. From my journey so far, I know that weak knees and drooping hands are part of the sequelae of back pain treated using the Nwugarian technique. Vice Chancellor, sir, when the healing hands were fully prepared, my contribution to the development of Nwugarian technique, clinical services, and society changed. First, we discovered that the Nwugarian technique treats multiple ailments. Discovery of the multiple ailments treated by Nwugarian technique. It is known that physicians and surgeons refer patients with non-specific back pain for physiotherapy, while retaining those with organic disease. In 1977, one of the such patients, please, I was not there, was referred for bladder training with a diagnosis of dyspnea and bladder dysfunction, but was found on mechanical examination of the spine to have concomitant lumbosacral and cervicothoracic spinal dysfunction and back pain. Her breathing and renal function normalized after using the Nwugarian technique. Thereafter, patients that presented with such sinister symptoms had their spine examined, and those with spinal dysfunction were treated using the Nwugarian technique. The case notes of patients referred from 1977 to 2007 were reviewed, and those that presented with the characteristics of spinal dysfunction were selected for further review and analysis. 5 selection criteria included: 1, that diagnosis of the referring physician or surgeon did not suggest the presence of spinal dysfunction. 2, patients presented with at least one of the characteristics of symptoms such as numbness, unilateral headache, urinary retention, breathing difficulty, and so on. 3, symptoms as reported by the patient reduced at least 80% after treatment. Some of these symptoms treated and the diagnosis of the referring doctor include growing pain. The diagnosis was ovarian cyst, urinary retention plus high respiratory rate. The diagnosis was bladder dysfunction and dyspnea. Scalp tenderness was diagnosed as head pain. Breast pain was diagnosed as there was a query breast cancer, and nose and scalp heaviness was query hypertension, were symptoms found only among females. Involuntary penile erection was a diagnosed erectile disorder, was found in males only. Other symptoms such as pain near the umbilicus was diagnosed as appendicitis. General edema, expressionless mask face was diagnosed as incipient Parkinsonism. Headache with constant cricket sound inside the head was diagnosed as migraine, and some of them as tinnitus. Weakness of one side of the body was diagnosed as transient ischemic attack or stroke. Painful eye was diagnosed as eye pain, chest pain, pain in the chest, and headache with noise in both ears as tinnitus. These affected both males and females. This was published in Journal of Family Medicine and Community Health in China as symptoms of spinal dysfunction mimicking systemic disease, Ogbonnia syndrome, in 2013. Then I started solving other challenges identified by Professor Nwuga and others. Some of the challenges included how the Nwugarian techniques achieve its effects is not known. The mode of action is not clearly delineated. How safe this technique is when applied in the presence of other ailments such as high blood pressure and respiratory problems are not known. What diagnostic models serve the purpose of this unique technique is not known. There is no electronic way of determining dosage. So I picked up these challenges and started addressing them one after the other. First, how does Nwugarian technique achieve its effect? What is the mode of action? In order to be able to answer the first 2 questions, I studied the effect of vertical oscillatory pressure, which is the most versatile Nwugarian technique on pain intensity and evoked potentials of people with low back pain and neck pain using electroencephalography. as shown in figure 25 and 26. Vertical oscillatory pressure was split into two stages, digital pressure and oscillation stages. The electrical activities in sensory areas of the brain was then monitored during treatment, as shown in figure 27. An opioid blocker, naloxone, was administered midway during treatment. It was found that naloxone reduced the pain-relieving effect of vertical oscillatory pressure, confirming the fact that apart from the mechanical effects, opioids are released in the brain during vertical oscillatory pressure to enhance the pain-relieving effects. This explains the neurophysiologic pathway through which the Nwugarian technique achieves its effect, and this finding was published in International Journal of Medicine and Medical Sciences in 2012. For this study, I'm always grateful to my supervisor, the late Professor Isaac Adeoshu, and my co-supervisors, Professor Mbobi Olaogu and Professor I.C. Ikem. Before this study, we had speculated that in our earlier research published in Journal of Japanese Physical Therapy Association that vertical oscillatory pressure plays up the neuroinhibitory mechanisms and facilitates the release of opioid peptides to achieve its therapeutic efficacy in youth. In elders, however, the efficacy of VOP is hinged on overcoming of degenerative restrictions and or malalignments to desensitize irritant focus in the painful spinal segment. This is added to the modulator effects of opioid peptides and neuroinhibition as confirmed. We conducted a systematic review and found that there is a moderate quality evidence that addition of manipulative therapy to a multimodal treatment regimen for chronic low back pain results in better outcomes in terms of pain and function as compared to other conservative interventions. This was published in the Proceedings of Singapore Healthcare in 2017. In the study titled Relative Therapeutic Efficacy of Some Vertebral Mobilization Techniques in the Management of Unilateral Cervical Spondylosis, a comparative study published in Journal of Physical Therapy Science in Japan, as earlier mentioned. I observed that oscillatory pressure techniques studied, that is anterior-posterior unilateral pressure, posterior-anterior unilateral pressure, cervical oscillatory rotation, and transverse oscillatory pressure, stretch cervical connective tissues and joint capsule to a variable point in the stress-strain curve. These points are ideal for stretching tissues to produce a salvo of beneficial neuroinhibitory and mechanical effects to a variable extent to determine their efficacy rating. It was pointed out that the difficulty of stabilizing a transverse pressure on the spinous process, especially in obese patients, and the resistance offered by neck extensor contraction, neck extensor muscle contraction to both transverse oscillatory pressure and posterior anterior unilateral pressure constitute a hindrance that makes it difficult to stretch the affected tissues to a more beneficial extent. Therefore, given the same intensity of pain, anterior-posterior unilateral pressure facilitates the application of appropriate force magnitude during digital pressure and an adequate number of oscillations to mobilize affected joints and stretch the tissue, the soft tissue, to achieve unrestricted and pain-free cervical motion. This is why anterior-posterior unilateral pressure has a superior analgesic potency over the other oscillatory techniques when used for the treatment of patients with neck pain. 2. How does Nwugarian technique affect comorbid conditions? We studied the effect of vertical oscillatory pressure on pain and some cardiovascular and respiratory variables in 2003 and 2017 respectively. These studies were concerned with identifying the immediate as opposed to long-term effect of vertical oscillatory pressure on pain intensity and cardiovascular responses. It was necessary because health professionals often get worried when manipulative therapy is to be used for patients with cardiovascular and or cardiorespiratory impairments. The results show that pain intensity increased during digital pressure, started releasing during oscillation, and patient resistance reduced alongside the blood pressure responded in a manner similar to the response of untreated controls. It was concluded in the first study that VOP relieved neck pain without significant effect on the heart, muscles, or blood vessels, suggesting that the Nwugarian technique is safe to apply on patients with mild to moderate heart impairment having neck pain. The second study found that the pain relieving effect of VOP is in fact beneficial to some people with respiratory impairment, indicating that respiratory distress is not a contraindication to this technique of the Nwugarian technique. 3, the Nwugarian diagnosis and manipulative therapy diagnostic model was developed. I have developed the diagnostic principle guiding Nwugarian technique and presented them as the Nwugarian diagnosis and manipulative therapy model. In summary, degenerative dysfunction induces neurochemical and soft tissue symptoms that later become peripheralized to mimic systemic diseases. This symptom is retraceable to the originating joint, but the disconnect between the symptom location and its origin beclouds interpretation of assessment outcome and obscure clinical reasoning. The Nwugarian diagnosis assists to clear this fog. Service to Obafemi University and related institutions. Mr. Vice Chancellor, sir, even as a young academic, I was saddled with the responsibility of coordinating the Bachelor of Medical Rehabilitation program and an assistant coordinator of Part 1 medical and dental programs in 1995. By the year 2000, I was appointed the coordinator of Part 1 medical and dental programs and coordinator of the postgraduate program in the Department of Medical Rehabilitation. All this took place because of the exodus of academics from the Department of Medical Rehabilitation in search of greener pastures abroad. After successfully defending my PhD, I was appointed acting head of the Department of Medical Rehabilitation in 2005. With this appointment, I became the first alumnus to head the Department of Medical Rehabilitation. Through this assignment, I was vested with the responsibilities of chasing Part 1 results all over the university, draw timetables, invigilate examinations, process results through various boards and committees of the university. Within this period, I have represented the Faculty of Basic Medical Sciences in the Faculty Board and Faculty Review and Faculty Selection Panel of the Faculty of Agriculture between 2001 and 2003, and Faculty of Dentistry and in Southwest I represented too. I was the physiotherapist in charge of OAU contingent, in charge of OAU students at a faculty sports competition in 2000 and 2001. I was the physiotherapist in charge of the OAU contingent to Nigerian University Games Association sports competition that took place in Ahmadu Bello University in Zaria. Thereafter, I was appointed head fellow, or fellow clinical hostel. I was the chairman of the local organizing committee that successfully organized the 10th Faculty of Basic Medical Sciences Week recently, as shown in figure 29. I have supervised and graduated 3 PhDs, 12 MScs, and numerous bachelor students. And I am the current head Department of Medical Rehabilitation in this great university. I have played many other roles in the university that time and space will not allow me to enumerate. I have been playing leadership role in the clinical training of medical rehabilitation students, physiotherapy interns, and physiotherapists specializing in orthopedic physiotherapy generally and manipulative therapy specifically, while rendering clinical services to patients and clients at the Obafemi Awolowo University Teaching Hospital Complex, Ile-Ife. I was the founding acting dean, Faculty of Medical Rehabilitation, University of Medical Sciences, Ondo, as shown in figure 30. We developed the curriculum for Doctor of Physiotherapy degree program and Bachelor of Occupational Therapy, Speech Therapy, Audiology, and prosthetics, and orthotics programs that have been approved by the University Senate, and all of them are approved by National University Commission and Medical Rehabilitation Therapists Board of Nigeria. I have also been external examiner to physiotherapy programs in University of Ibadan, Bayero University, Kano, Nnamdi Azikiwe University, Nnewi campus, University of Nigeria, Enugu campus at different times. Service to my professional associations. Mr. Vice Chancellor, sir, I have also contributed to the growth and development of my professional associations. I was Vice President of Nigeria Society of Physiotherapy, Osun State Chapter, between 1997 to 1999. Editorial Consultant, Journal of Nigeria Society of Physiotherapy, and Medical Rehabilitation Therapists Registration Board Journal and Bulletin between 2004 and 2012. I served as a member of the Governing Board of Medical Rehabilitation Therapists Board 2009 to 2012, a pioneer member of the Governing Council of Postgraduate Physiotherapy College of Nigeria between 2013 to 2016, and a consultant to MRB TB in 2012. I've been involved in MRB TB accreditation and re-accreditation of hospitals for internship, training, and safe medical rehabilitation practices in Nigeria. I was a member of National Working Committee for the design and curriculum development of National Postgraduate Physiotherapy College in 2013, and I was also a member of the first Postgraduate College Selection Panel on the award of fellowship by election in 2013. In order to further foster the understanding of basic knowledge of manipulative therapy among health work professionals, I have presented papers during the conferences of relevant professional associations as follows. I presented a paper titled Identification and Treatment of Cervicocranial Radiculopathy Using Spinal Manual Therapy during the Scientific Conference of Nigeria Society of Physiotherapy in 1998. During the 1999 Conference of Neuroscience Society of Nigeria, I presented a paper titled Effect of Mechanical Stimulation at 6 Cervical Vertebrae on some sympathetically controlled cardiovascular functions. I have also presented a paper titled Low Back Pain Response to Manual Stimulus, an age-related phenomenon, during the 6th International Conference of Neuroscientists of Africa, SONA, in Hilton Hotel, Abuja in 2003. In 2013, during the 2nd International Conference on Inhibition on Orthopedics and Rheumatology in Las Vegas, USA, I presented a paper titled Relative Sensitivity and Specificity of Some Provocative Tests in the Mechanical Diagnosis of Sacroiliac Joint Dysfunction among Patients with Low Back Pain. Incidentally, I had presented a paper titled Introduction to How Spinal Manual Therapy Achieves Pain Relief during the conference of the Society for the Study of Pain in Nigeria in 2003. Mr. Vice Chancellor, sir, just this year, the same Society for the Study of Pain invited me to present a keynote speech on pain in the workplace, which I gladly did. I have conducted workshops on the Nwugarian technique across the country over the years, some of which include the workshop of Nigeria Association of Orthopedic Manual Therapists in Uyo 2014 and Lagos 2016, and for NSP in Ogun State, Chapter 2001, 2021, and in Oyo State in 2022. Community service. Over the years, I have been attending to individuals with diverse musculoskeletal ailments in Obafemi Awolowo University and rendering clinical services to Obafemi Awolowo University Teaching Hospital. Most of the time, I have had to treat many people affected with back pain of various intensities, spread, and complications, including those with symptoms of spinal dysfunction mimicking systemic diseases. Anybody who has had the fortune or misfortune to receive the Nwugarian technique will testify to the fact that the experience could range from severely painful to what some people call sweet pain. So if you are moving on campus and you hear someone calling me names such as physiotherapist, bone crusher, bone bender, muscle engineer, our healer, and so on, they are all describing their experience during manipulative therapy. However, one experience they share is that they always recover from their ailment and are always grateful, because some of them would have been booked for surgery and some would have been enduring pain for years before an unseen hand directed them to us for salvation. Some of them who had been officially referred outside Ife recently are currently responding to manipulative therapy. So the Nwugarian technique is very effective. It is an essential tool in the hands of the physiotherapists, underutilized by health managers, at least not officially. Nwuga Physiotherapy Foundation and Advocacy. Nigerian Society of Physiotherapy decided to form a not-for-profit foundation in 2013. The foundation was named after Professor Nwuga, the progenitor of the Nwugarian technique, in recognition of his unique contribution to the body of knowledge of physiotherapy and his novel technique. I was appointed the founding chairman and CEO of the Nwuga Physiotherapy Foundation in the year 2014 to drive the vision of NSP in the foundation. In 2015, I and the then president of NSP, Dr. Tayo Oyewumi, visited the headquarters of American Physical Therapy Association in Fairfax Street, Alexandria, Virginia. This building also houses the Foundation for Physical Therapy. Our mission was to understudy the Foundation for Physical Therapy and American Physical Therapy Association to understand how such foundation is run for us to start properly, as shown in figure 31. Since then, we have organized several workshops to disseminate information about the Nwugarian technique and distinguished Nwuga Physiotherapy Foundation lectures, as shown in figure 32 to 36. The first lecture took place here in Obafemi Awolowo University on the 23rd of July, 2015. This was presented by Professor Chukwuka Agwemeka, who was the Provost and Senior Vice President of San Diego University, USO. The lecture was titled Quantum Medicine, the Promise of Light as a Clinical Armamentarium, as shown in figure 32 and 33. Incidentally, Professor Nwuga died just a day before this lecture. May we rise for a minute of silence in respect of his departed soul. May his soul rest in peace. The second lecturer was Professor Ola Sonia, a former Deputy Vice Chancellor of University of Ibadan and former Oyo State Health Commissioner, shown in figure 34. This lecture was titled Nwugarian Ideas for Physiotherapy in Nigeria, a mentee's review 1 year after. I was honored to be the one to give the third lecture titled Nwugarian Technique of Manipulative Therapy, a solution to myriad of human ailments, as shown in figure 35. Professor Fatai Adeniyi, who is here present, Deputy Provost, College of Medicine, University of Ibadan, gave the fourth lecture titled Reaping the Byproduct of Investment, the Gain of Sustainable Physical Activities in a Depressed Economy, as shown in figure 36. This lecture was attended by the Chief Medical Director, University College Hospital, Vice Chancellor, University of Ibadan, Health Commissioner, and the Acting Governor of Oyo State, where it took place. It is therefore evident that efforts have been made over the years to spread the good news about the Nwugarian technique and the Nwugarian ideas for physiotherapy in Nigeria to students, practicing clinicians, academic physiotherapists, other healthcare providers, and the general public through the manipulative therapy courses taught at the undergraduate and postgraduate. It is also done by organizing workshops through Nwugarion Institute for Back Pain Management before now, and currently through the Nwugga Physiotherapy Foundation workshops and public lectures. The future of Nwugarian technique of manipulative therapy. Working with other colleagues and proteges and enthusiasts in the Nwugarian technique, we have developed and tested the feasibility of an instructional video on perceived skills and as a teaching and learning resource for Nwugarian technique education. This we have done because use of technology such as videos offer great versatility and potential when used for teaching, as shown in figure 37. The future of Nwugarian technique is in effective communication of techniques where skills required for practice can be disseminated through standardized means. Optimizing the forces needed and applied during Nwugarian technique is still subjective. Recently, we have developed and tested the feasibility of a digital pressure sensor machine to measure forces applied during manipulative therapy among patients with chronic low back pain, as shown in figure 38 to 42. We found the digital pressure sensor machine to have a good to excellent usability to optimize the needed and applied forces. The digital pressure sensor machine has average and fair sensitivity and specificity compared with pain pressure threshold scale. In order to limit misdiagnosis, a clinical decision support system was developed based on artificial intelligence and machine learning approach, as shown in figure 40 and 41. This research is supported by the Health and Education Research and Knowledge Exchange funding of the Manchester Metropolitan University in the United Kingdom. This tool will go a long way in helping to determine the suitability of patients for Nwugarian technique. Conclusion. The Incredible Hulk, a superhero renowned for his unmatched physical strength in Marvel comic universe, derives his extraordinary power from his mighty back. His posture, stability, core strength, power generation, and exceptional mobility, exemplified by his remarkable long-distance leaps, all stem from the foundation of his robust back. This underlines a profound recognition, even within the realm of comics, that the back stands as the pivotal cornerstone for a range of human physical activities. As those who have experienced it before will testify, when the back fails, a strong man becomes like a vegetable. But don't worry, the healing hands of a Nwugarian manipulative physiotherapist is always there to help. The Nwugarian technique is an important tool in the hands of a manipulative physiotherapist that can be used to heal multiple human ailments that often escape the dragnet of the doctors who stand at the gateway into the healthcare system. I have made my contributions to make it easier, more scientific, and more user-friendly. Recommendations and policy implications. Physiotherapists should aspire to have this skill, and patients whose ailments refuses to respond to conventional treatment should give it a try before giving up hope. Government should, through health authorities, ministries of health from federal to the local, should develop a policy that engages certified practitioners of the Nwugarian technique to be part of the gatekeepers into the healthcare system in order to be able to identify patients with symptoms of spinal dysfunction mimicking systemic disease using the Nwugarian model of diagnosis. This will help to reduce the suffering of patients whose primary back pain has graduated to secondary one, especially now that we are in a depressed economic ecosystem in Nigeria. Also, the university management is encouraged to donate a secretariat for the use of Nwugarian for the Nwuga Physiotherapy Foundation as a matter of urgency in order to domesticate in OAU what rightly belongs to Obafemi Awolowo University. Before others will take it away. Appreciation. Mr. Vice Chancellor, sir, this day provides me an opportunity to appreciate all those who have contributed to my journey so far. I'm grateful to the Almighty God for making this day possible, and to my parents, the late Mr. Sylvester Egwu and his late wife, Grace, from whom I inherited a stable gene that brought me this far. I am equally grateful to my late father-in-law, Emmanuel Amawachi, and his late wife, Beatrice, who gave birth and nurtured my darling wife, who has been my backbone over the years. I thank my siblings for their love, prayers, and endless support. Mrs. Nkechinyere Abaga and Mr. Augustine Otu are here to represent my siblings. Please, if you are here, can you stand up for recognition? Yes, thank you. They have come all the way from the east to grace this occasion. I deeply appreciate my wife, Dr. Mrs. Bridget Uchenna, who has stood by me throughout my academic and general life struggles. May God continue to reward your sacrifices of love and service to me and the children. I also appreciate my children. First, my twins, Teresa and Emmanuel. Today is your birthday. I wish you happy birthday. I also wish all those who were born today happy birthday. May God grant you many more years and their siblings, Grace and Ikechukwu. I thank you all for your constant prayers, understanding, and endurance during the hard times. I am grateful to my in-laws, my colleagues in the academic and clinical departments of medical rehabilitation, all unit heads in the Ile-Ife and Ilesha Hospital unit, and others. To the clerical and technical staff in the department, I thank you all. I thank all those who have impacted on my growth in life, including all my teachers, mentors, students, academics, administrators, and administrative and technical staff of this university, friends, well-wishers, the priests and members of Our Lady of Perpetual Light Catholic Church. I thank all of you. I'm also thankful to members of the Board of Trustees and Monument Committee of Nwuga Physiotherapy Foundation for their selfless services. Finally, I especially thank Mrs. Gladys Olupeju Nwuga, who is also a physiotherapist and a pioneer staff of the Department of Medical Rehabilitation, and her children for their strong support for Nwuga Physiotherapy Foundation. A famous 8-stanza poem titled Victory ran thus: "You are the man who used to boast that you will achieve the uttermost someday. You merely wish to demonstrate how much you know and prove the distance you can go. Another year we've just passed through. What ideas came to you? Time left 12 fresh months in your care. How many of them did you share with opportunity and dare? Again, were you so often missed? We do not find you on the list of makers good. Explain the fact." No, it was not the chance you lacked. As usual, you failed to act. Or did you act to fail? Mr. Vice Chancellor, sir, from the above poem, it is obvious that having the right opportunities does not guarantee success in one's career. That I have the opportunity to present an inaugural lecture before the end of my academic career is by the grace of God. To God be the glory. Thank you very much. Thank you, ma'am.